Well, thanks very much. Thank you very much. That's hugely generous of you. I haven't heard my full name for many, many years. In fact, I've forgotten the middle bit, but there you go. I think this must be the day of campaigns because there are so many going on today. So forgive me if I slip away. Is it better if I'm close or further away? Further away. Forgive me if I slip away to a Palestinian solidarity campaign, and I know many people. I know many people there would wish to be here, and many people here will support the Palestinians. I'm somewhat in awe of saying anything today because I know there are people here that we go to when we're doing research. We go to you for your stories and your insights. People who organize campaigns, people with authority, running local authorities who are in the forefront of the battle, and particularly people who work in the health service like you do here. And we respect your work, of course, and we depend on you for your stories and your insights. And what insights they are. We hear, well, all of us hear about the terrible weight of pressure on the staff who work in the health service. We hear of the cuts to services, the closures. We hear of the collapse or near collapse of social care from carers who go round to support old people in their homes, and the tiny amount of time they have to enable people to have a life of dignity, and then they have to wait for hours unpaid between visits, which of course puts them under intolerable pressure. So we hear all that, and very important it is. It's what drives our campaigns. And the stories keep coming. Yesterday, there were 2 more stories, which you probably read about. One was of trainee doctors left unpaid for weeks on end, working in GP surgeries, because a private company, Capita, couldn't get their act together to get them paid. Absolute failure again of privatization. And another figure in the paper yesterday, just yesterday, that of ambulances going to A&E where the people needed a place in an emergency ward were waiting over an hour in the ambulance. That number doubled in the last 2 years. 2 years ago, there were 50,000 cases of people having to wait over an hour in an ambulance. Last year, it was over 100,000. So yet again, day after day, there is evidence that the health service needs your campaigns. It needs our support. And under the current system, it is failing. One element that we tend not to talk about, and I wanted just to describe briefly, is about dentistry. There's a new book come out, which I found hugely valuable. It's called The New Poverty, by a writer called Stephen Armstrong. I haven't read his work before, but this is terrific. And it's a great resource for anyone involved in campaigns who wants to pursue the drive against austerity. This book will give you absolutely rock-solid ammunition. And he writes about how dentistry has almost collapsed now for people who can't afford private care. And he describes 1 or 2 cases. He describes a young mother who says, DIY is just cheaper than the dentist. My uncle takes care of his teeth and everyone in the family. He writes about a woman popping her own mouth abscess with a fork since she was worried about a fine for a missed appointment at the job center, at a private dentist. He describes how one of the biggest sellers of dental first aid kits Dentech shifts over 250,000 kits in a year, 250,000 kits for people to look after their own teeth. In 2012, the British Dental Health Foundation found that 1 in 5 Britons would remove a tooth themselves or ask a friend to do so if they couldn't afford dental treatment. He describes a 40-year-old HGV driver who used a plastic mirror, forceps, and probe from an over-the-counter dental kit to clean and prepare a cavity before, and this is the best bit, before plugging the hole with quick steel, a potentially toxic steel reinforcement epoxy putty used to fix engines. His local dentist had discontinued NHS dental services, and he couldn't afford private dental care. There was a dentist in Dewsbury, obviously a very man with a great sense of public duty, referred to as Nick O'Donovan. And he said, the mouths that we saw looked like a hand grenade had gone off in them. He said there were people who glued dentures in with super glue, stuck needles into abscesses to get rid of an infection. And he writes of one woman who'd been in agony, where he had to correct the mess that she'd made when she pulled out her own tooth with a pair of pliers in her garden shed. And the story was this. Her dad was also suffering from toothache, so they met in her garden shed, drank whiskey, and pulled their teeth out with pliers. Her dad managed to get his out, but Claire's broke, and the pain was indescribable. That's what they've done to National Health Dentistry. And we tend to forget it, so let's keep that on the agenda. And we always talk, and people have said it already today, and they're quite right to say it, that the National Health Service is probably the greatest achievement of the Labour movement in this country, a huge achievement, and one we absolutely have to defend. And it arose when we'd won a war as one and felt great solidarity with each other. We treated each other as neighbours, as good neighbours. We looked after each other from the cradle to the grave. At least that was the plan. I looked at the Labour manifesto yesterday and found it was surprisingly modest. It didn't describe the great project that Anar in Bevan was going to build. And I compared it to the 2017 manifesto of the Labour Party, and a manifesto that many of us were very pleased to support and campaign for, and it led us to a considerable success. And it said, as people here will know, it talked about proper funding in the important areas. It talked about cutting waiting times. It talked about ending the postcode lotteries, properly funding primary care, social care, mental health, of course, many people say how important it is, but the money doesn't seem to get there. To properly invest in public health, in a new strategy for childhood obesity, another terrible time bomb waiting to make people's lives misery, and many things, and £30 billion extra funding, absolutely brilliant. There's one point I want to make, though, and I think this is really important. It said, Labour will reverse privatisation of the National Health Service. Good. But I want to know, why won't they end it? Why won't they end it? And there's a giveaway. There are some weasel words here that we have to watch out for. It says, Labour will make the NHS their preferred provider. Labour will ensure that excess private profits are not made out of the NHS. Well, why not end privatisation and private profits altogether? Now, nearly finished. Now, I've heard Jeremy Corbyn say that everyone employed in the National Health Service everyone who works for the National Health Service will be employed by the National Health Service. Now, clearly there's a struggle going on. And those active in the Labour movement and active in the Labour Party have got to strengthen that idea that privatisation is finished, that it's a commitment in the next manifesto, it's a commitment in Labour Party policy, because there's an ideological split here. There's an ideological dispute. There are still some in the Labour movement and the Labour Party who think that private companies can be efficient, that think it's a necessary discipline. And as it happens, they happen to have connections to private healthcare companies, some of them. So let's carry this forward absolutely clearly. And let's have it in words of one syllable in the next Labour manifesto. Let's support Jeremy Corbyn and John McDonnell in their determination that that should happen. Let's get Labour MPs. Let's get Labour MPs and all representatives of Labour who are committed to that, because if we go into Parliament with the majority as they are, we're going to struggle to carry this through. Let's have people who represent us who believe in a National Health Service where everyone is employed by the National Health Service under proper wages and conditions with trade union rights, no 0 hours contracts or any of that nonsense. Let's defend Nye Bevan's health service, and let's make certain this Labour Party defends it absolutely to the hilt. Solidarity.